Welcome to the Dr. Janine Show. I'm Dr. Janine Bowering, naturopathic doctor, and today we are talking about signs your pancreas is in trouble and how to heal it naturally. So pancreatic disease is definitely on the rise. I'll be talking about pancreatitis, which is inflammation in the pancreas, but also fatty pancreas. And this is something that maybe you've not yet heard about, but similar to non-alcoholic fatty liver disease, there's also fatty pancreas. And this can develop as it's not related to alcoholism, the same with the liver. So we're going to talk a little bit about this and what we can do naturally to deal with this. So I'll talk about also some of the causes of these conditions and some of the symptoms that may be indicating that you may have some problems with the pancreas. I'll also discuss the tips and what we can do naturally to prevent this, but also to deal with some of the symptoms which can be quite troublesome. So you may have heard about pancreatic disease in the news, and certainly most recently the loss of Alec Trebek, who had pancreatic cancer. Also in the past, Patrick Swayze also had pancreatic cancer and died of that. Luciano Pavarotti. Also, Steve Jobs lost his life to a neuroendocrine tumor in the pancreatic region. Ruth Bader Ginsburg, the Supreme Court judge, recently died of pancreatic cancer, and Aretha Franklin. So you've heard about this in the news. I know that I had a lot of questions and commentary on TikTok and on YouTube as well, questioning what can we do to prevent this, because it is a very scary disease. So if you're new to my channel, welcome in. I'm Dr. Janine Bowering. Make sure that you're subscribed so that you always get my newest and latest uploads. And I'd love to hear from you as well. So if you've had experience with pancreatic issues, also if you have concerns, you have questions, I'd love to hear from you. So please be sure to add that in the comment section below. And I truly appreciate all the thumbs ups that you can give me throughout the course of this video, and it really does help when you share my videos as well. Okay, so let's get right into it. What is pancreatitis? So any type of itis is an inflammation of that organ. And when we talk about the pancreas, so the pancreas is a leaf-shaped organ, and we can see it here, and it has two functions. So it has both an endocrine and an exocrine function. So the endocrine part, you've probably heard of insulin and helping to regulate our blood glucose levels, but the exocrine part of the pancreatic function deals with secreting digestive enzymes to break down our food. And one of the beliefs as to the causative factors of the pancreatitis, the inflammation, is that that secretion of the enzymes starts to self-attack the pancreas itself, and this can, of course, would be very inflammatory in terms of a cause for why the pancreas is inflamed and having difficulty. Now, another cause that you probably haven't heard about is the relationship with leptin resistance. So this is something that, in terms of, fixing our leptin levels, it's something that I talk a lot about in probably most of my videos most recently. So if you missed that show on leptin resistance, make sure that you check that out, because that has a lot to do with our insulin levels and the functioning of our brain and our entire cascade of what happens hormonally in our relationship to our environment. And our brain is always getting those signals as to how we're doing. Are we okay? Are we not okay? And this is important that we fix that leptin signaling so that the brain is getting those right messages. And this has, goes a long way at helping us in terms of balancing our circadian rhythms and the way that our bodies are supposed to work in conjunction with nature. Now, fatty pancreas is maybe something that you've not heard about, and much like non-alcoholic fatty liver disease, this is an increase in the fat in the pancreas itself, and this is related to metabolic syndrome. So again, not finding that balance in terms of being able to balance that blood glucose level. So this was actually discovered in 1933, and yet still we don't hear a lot about fatty pancreas. And there is death of something called the acinar cells within the pancreas, and they are replaced with fat in this condition. So some of the risk factors of developing the fatty pancreas pancreas include obesity and being overweight, also with increasing age, and it tends to be more common in men opposed to women. Also, an increase in blood pressure is a risk factor, and certainly alcohol use is not the best thing when we talk about fatty pancreas, and also increased ferritin levels. So of course this has to do with your iron levels. So if you're just tuning in, welcome in. Today we're discussing signs your pancreas is in trouble and how to heal it naturally. So giving you natural tips how to, get over and actually prevent pancreatic troubles down the road. So let's now talk about the causes of pancreatitis and fatty pancreas. So one of them, of course, would be alcohol. And so watching alcohol consumption definitely is important when we are trying to, keep our pancreas healthy, as well as gallstones. So gallstones can cause blockages in terms of our tubing. And when we have gallstones, it definitely puts us at higher risk for pancreatitis. Also, any type of abdominal surgery is linked to pancreatitis because there could have been a cutoff of blood supply to the pancreas, and then therefore there is inflammation ensuing after that. Also, certain medications can be linked to lack of pancreas health. So these could be antibiotics, NSAIDs, which are non-steroidal anti-inflammatories, and steroids as well can put you at risk. Also, smoking and increased in triglyceride levels can be linked to pancreatitis. Also, low vitamin status. So a lot of our antioxidant vitamins like vitamin A, vitamin C, vitamin E, selenium, and carotenoids have been linked to pancreatitis. Also, too much calcium. So this is one of the reasons why supplementing and making sure that you're getting enough vitamin K2 is important, because too much calcium that isn't properly absorbed and utilized by our body can also put you at risk for pancreatic disease. And another, of course, is high fat diet. So there's a fine line there, because for people that have watched me before, you know that I'm all about having healthy fats in the diet, but certainly going with fatty, processed foods and fast foods is not the best thing for your pancreas. So now we'll talk about some of the symptoms of pancreatitis, and it could be sharp abdominal pains that you don't want to ignore, and these pains can actually travel to the back. And this is a medical emergency. You definitely have to seek out the advice of a healthcare professional and making sure that you're getting this properly diagnosed. As well as there could be weight loss, also nausea and vomiting could be part of the pancreatitis, and a lot of gas. There could be diarrhea, and oscillating between diarrhea and constipation is another, GI symptom that can be related to the pancreatitis. Also, by looking at your stools. So if your stools are floating and there's a lot of fat in the stool and they're very pale colored and usually they'll be floating, this can be, again, a sign of pancreatic disease. So if you're just tuning in, welcome in. I'm talking about the signs that your pancreas is in trouble and how to heal it naturally. Okay, so let's get right into the tips. And I have 9 tips to help with pancreatitis. So tip number 1, again, if you've watched me before, you can probably guess it is to fix your leptin resistance. So we know that leptin signaling in our brain, and our fat cells are giving that signal to our brain in terms of our state of affairs. If we are okay, we have enough, food and access to nutrients by the amount of body fat that we have, or not. And this is what controls our hunger, it controls our sleep-wake cycles, it controls how much body fat we actually hold on to. And getting this under control is really important. So if you missed my episodes on leptin resistance, be sure to check those out. But some of the really quick tips here is to really watch your carbohydrate intake, especially the refined carbs and sweets. You want to not be spiking your insulin all the time, and you want to stop eating at least 3 hours before bedtime. You want to look at that morning sun. That's really, really important. I have other videos all about how to do that safely and effectively, and also decrease your artificial light, especially at nighttime after the sun has gone down. You want to use some cold therapy, so whether that's the cold showers or putting ice packs on your body, which is my preferred way of doing my cold therapy. I find it's just easier for me to do. But if you're all into doing cold dunks and going into cold showers, then all the power to you. That will really help your leptin resistance, but also is a great preventative for pancreatitis. Tip number 2 is to decrease your EMF exposure. So we know that EMF radiation, and I'm talking about non-native EMFs. So this is the EMFs from our cell phones, from our devices, anything that's basically plugged in and around us can have a negative impact on our overall health, but also can be a risk factor for pancreatic disease as well, and also can offset our leptin levels and really, messes up our internal battery. And this is our mitochondrial health, which is so important in terms of keeping our bodies healthy and for our longevity as well. So I have other tips in another video how to do that and how to really decrease your EMF exposure, so be sure to check that out. That will really help you. Tip number 3 is to decrease your caffeine consumption. So again, a little bit of caffeine at the right time, so a little bit later in the morning, not first thing in the morning, can be helpful for overall health and getting your liver going. But at the same time, overdoing it in terms of your caffeine consumption can have negative side effects as well for your health and of course for your pancreas. So you have to watch your caffeine intake just a little bit. Tip number 4 is to decrease your alcohol. So too much of alcohol we know is definitely a risk factor for the pancreatitis, but again, for the fact that it is a sugar most times, can also have that sort of double whammy effect and have that negative impact on your pancreas. Tip number 5 is to use a castor oil pack. So this is something that I've shared in TikTok, also here on YouTube. So maybe let's take a look at that now to show you how to do the castor oil pack, and we'll come right back in just a moment. But all you're going to do is purchase some castor oil, and hopefully it is an organic castor oil. Find it in your health food store, and it should be in a UV protected and hexane-free castor oil. So just do your best to find a high-quality castor oil. Now, what you're going to do is I just got an old face cloth that has not been bleached and it doesn't have any chemical residue in this. This is really important. So if you use fabric softener, you use different unhealthy, unnatural laundry soaps, you just want to maybe wash this again to make sure that you're using a pure cloth. Ideally, you can actually purchase in the health food stores a piece of flannel that is just pure organic flannel or pure organic cotton. It's completely up to you. You just want to be mindful that there's no chemical toxins within your piece of, and this is just a face cloth, but certainly you can go a little bit larger in terms of the size of cloth. Ideally, what you're wanting to do, and this is perfect for Lucy's size, so for me it's a little bit small in terms of the size. I may want to go with a hand towel, would be a better size, but you want to be able to, when we get to this part, ideally cover up the liver with your castor oil pack for your fatty liver disease. And what the castor oil does is it brings the lymph cells, so there's special lymph cells in the digestive tract. It also helps to bring blood and circulation and just has a really healing effect on the organs. I recommend this for women with menstrual cramps to do the castor oil pack a little bit lower down on the abdomen. It's incredible how powerful this is. Also for the ovaries, for polycystic ovaries, for a bunch of, different things that you can use this castor oil pack. It is fantastic. Okay, so basically what you're going to do, it's really simple, is you're going to soak your cloth with the castor oil. And you're going to do this as well as you can to soak the cloth, and you're going to let that soak in. And remember, one side of this cloth is going to be applied to your skin. So I'm not going to soak it in its entirety, but the great thing about the castor oil pack is that you can actually reuse it. So, and the next time that you use it, you're just going to add a little bit more castor oil, but this is reusable. So yeah, so when you're thinking, that it seems like a waste of the amount of castor oil that you're using, it's not. So just so that I'm not getting this too messy, but ideally I would actually soak this so that this would go through my first 1
to the other side, and maybe onto the next layer. So I would allow this to even saturate a little bit more. Okay, so here we go. So now all you're gonna do is take that. So ideally I would put this, I'm not gonna do it because I'm not gonna mess up my clothes. You're gonna take so the wet side down, but again, you could soak this so that it's completely saturated with the castor oil. And some of that castor oil will actually be absorbed into your skin, which is great, but now you're going to apply it to the liver. So remember, the liver is on the right side of your body. So just under your right rib cage. So I want everybody at home right now, go to your right rib cage and just feel under there. Ideally for the liver, if you're treating your liver, that's where you're going to place your castor oil pack. So just as I've done it here on Lucy's liver, and I would probably put it up a little bit higher. There we go. And then what you're going to do is you're going to get some plastic. So you could use plastic wrap. I'm using my, recyclable, compostable plastic, and you're going to cover that up. And that's just for the messiness, because now ideally what you're going to do is actually put a hot water bottle. And because you know that I'm against the EMFs and things, I don't like the heating pads. If you have to use a heating pad, great, but I prefer a hot water bottle. So if you can find that, purchase that. They sell them everywhere. Get a hot water bottle, fill it up as hot as you can stand it, and then now place that on top of the plastic. And you're going to allow that to just sit and relax. So you're going to put on your movie, you're going to watch my YouTube videos on the Dr. Janine show for 45 minutes, okay? So that's the ideal time, 45 minutes to an hour. You're going to watch your YouTube, scroll through your TikToks and like all my videos as you're doing it. But that is the way to do it. Then when you're finished, of course, you're going to take off the plastic. Now what you're going to do is just have a glass bottle nearby, so a mason jar, and you're just going to save your castor oil pack in your jar for next time. And then you can reuse it. And that's the beauty of doing the castor oil pack, is that it's reusable. Now the next time you use it, you're just going to add some more castor oil to your cloth, and you do that. Now ideally you're doing this about 3 times per week. It depends, of course, on your condition, how advanced the fatty liver is. But again, there's so many different uses for this. And I promise we're going to do some TikToks on this, and I can share different aspects of how you can use the castor oil packs.
So you can see there in that video, I was focusing on the placement of the castor oil pack over to the right-hand side for the liver health. So that's still great for our internal organs and getting that lymphatic flow going and the blood flow as well. But for pancreatitis, you might want to be more centralized in terms of your placement of your castor oil pack over the abdomen on both left and right sides, so right in the middle, and this will really help to target the health of the pancreas and the blood flow there. Tip number 6 is to use Gymnema. So Gymnema sylvester has been shown in the literature to actually help with the pancreas health. And in this study, we can see that the phytochemical and pharmacological properties of Gymnema are important in terms of being a medicinal plant. And it actually showed that, the authors discussed helping to promote regeneration of the pancreas. So that is a pretty big statement to be able to say that. So yes, absolutely, using herbal medicines is by far, one of my favorite things to do, because naturally occurring from Mother Nature, these herbal medicines can really help to find balance and really target different organs when we're wanting to do that. So Gymnema is really helpful at balancing blood glucose levels, and we know that it has an impact on the way that our pancreas functions, because our pancreas has to secrete enzymes to help to break down our carbohydrates. So what we're doing is we're hoping to help that pancreas out so that it's not overtaxed, and some of the herbal medicines like Gymnema are fantastic to be able to do this. Tip number 7 is to include L-Glutamine in the diet. So this has been known to really help with pancreatic function, and finding a good high quality protein powder that contains, as a functional protein, contains glutamine is a great way to go to really really help to heal the leaky gut syndrome, but also to ensure that you are protecting that pancreas and helping from a preventative standpoint, especially as you're aging. So L-Glutamine is definitely one of those things to look for. Tip number 8 is to use specific supplements for pancreatitis and as a preventative as well. So certainly vitamin D3 we know is really important for our immune function, but for digestive function as well, and really important for our pancreas. As well as vitamin C is very important and an important antioxidant. And like I said at the beginning of today's video, that a lack of vitamin C and vitamin K can be attributed to, problems with the pancreas. So making sure that we're getting, of course, whole food sources of these nutrients is very important for preventing any pancreatic distress. Another thing to consider is taking digestive enzymes. So again, taking that pressure off the pancreas to secrete and do its exocrine function of secreting all those digestive enzymes. By taking a good quality digestive enzyme, this is a great way to help the pancreas out, help out your digestive tract, to help to decrease some of that inflammation that's happening, because then effectively you will be helping to break down your food by taking the digestive enzymes. And also, of course, probiotics. So probiotics, making sure that this is designed for your human digestive tract, is really important to help with not only the breakdown of your foods and the metabolism of your vitamins, but also to ensure that your immune system is working as it should, and having that healthy microbiome and, making sure that we don't have leaky gut syndrome is really important for your overall pancreatic health as well. And tip number 9 is to ensure that you're including some healthy fats in your diet. So one of my favorites is coconut oil, because coconut oil specifically does not need the pancreas to do a huge job to digest the fat. So this is really important. It has its own metabolic way of being metabolized. So coconut oil is definitely your best friend when we're talking about the prevention of pancreatitis, as well as using some healthy DHA. So those omega-3s that have been known, and in this study shows that the role of omega-3 fatty acids in acute pancreatitis, and this was a meta-analysis that showed that the administration of the omega-3s may be beneficial for decreasing mortality, infectious complications, and the length of hospital stay in acute pancreatitis. So that again is a promising look at, again, how natural, things that we can do can really help our overall health and prevent disease. So I hope you learned something new in today's video, and please, I would love to hear from you. Maybe you're suffering with fatty pancreas or pancreatitis. Make sure, of course, that you're always working with your practitioner, but I'd love to hear from you. So please leave your questions and your comments below in that section, and I will definitely get back to you. Please be sure to share this video as well, and please give me a big thumbs up. I truly appreciate all of that great feedback that you send me. And if you're new here, welcome in. Please make sure that you're subscribed and click that bell so you turn on the notifications and click all notifications so you get my newest and latest uploads every single day. Remember to always take good care of your health and do it naturally. Thanks for watching today.